Being that you all enjoyed that video that I did a few weeks ago where I talked about things that we are not doing in 2023, I decided to come back with another video talking about things that we are doing in 2023. So let's get into it. We are using our PTO, our vacation, and our holiday time. We're not just collecting it in a bucket and just leaving it there, okay? Not unless you know you have something planned coming up, you have a wedding that you want to take off time for, but just to save your PTO, no, we're using our PTO time. Even if it's a staycation, stay home, okay? Get your rest, protect your mental health. We're using the PTO time. Number two, once we get to work, we are leaving all of our personal problems at home. We're going to go in with a positive attitude. When we see our coworkers, we are going to smile. We're going to say, good morning. How are you doing? Now, I know a lot of you are going to give me pushback on this, saying things like, well, I'm not a morning person. It costs you nothing to be polite. You don't have to be a morning person to be polite. You can see your coworker, say good morning, say hello. But no longer are we just passing each other straight, all right? We're saying good morning for 2023. Number three, we are being nice to the nursing students and to their instructors. We are welcoming them into our units. Why? Because we're going to need them to staff the unit in the next year or two when everyone else quits and moves on, okay? So when the nursing students come on the unit, please don't meet them with dirty looks or just blatant disregard. Be kind to your nursing students because, like I said, we're going to need them. Number four, we are being kind and we are being supportive to each other. We are done with the days of nurses eating their young or eating each other. If you're working with a colleague and that colleague may not know how to perform a certain skill and you have to help them, or you have to identify, or you found something before they did, found out something about their patient before they knew it, don't go around and gossip about it. It's a team effort. Be nice to one another. We have enough stress dealing with all of these sick patients as is. Let's just be kind to one another, please. Number five, this one might be a little bit strange, but we are not giving the hospitals our money, okay? We are bringing our breakfast, we're bringing our lunch, we're bringing our snacks, our water. We need to be healthy, okay? 2023, we are focused on nutrition, we're focused on fitness, we're focused on being the best versions of ourselves. Hospital food tends to be loaded with sodium. Sometimes we don't even have a good selection. The salad bar is practically non-existent. So 2023, we're bringing our Number six, 2023, we are using the bathroom. Those days of holding your urine until 4 o'clock in the afternoon, talking about, oh my God, I didn't even pee, or I just finally used the bathroom when it's 4:45, we're done with that. You're not holding your bladder any longer. You're going to go use the bathroom and relieve yourself as a normal human being, okay? The work is not going anywhere. The work will always be there. Please use the bathroom. I lost track of the numbers, but I think we're on number six. Okay, so we're going with number six. We are drinking our water, our tea, our coffee with or without the hydration station. So a lot of hospitals have adopted hydration stations to be in compliance with Joint Commission, but there are some hospitals that do not have a hydration station present at the nurses station. If you're not sure what a hydration station is, it's a specific area where the nurses can put their water bottles, their coffee, their whatever it is that they're drinking to keep hydrated throughout the shift. But like I said, no more dehydration. We're drinking our water. I don't care if I have to keep it at my little alcove that I'm sitting at, if it has to sit at the nurse's station, because I need to have access to it with all of the ripping and running that I'm doing. Also, hospitals, you guys know when Joint Commission is coming. Why are we playing these games? Because when Joint Commission comes, you all are well staffed. So on that note, keep your water at your side. We need to be hydrated. This is the one. I don't know if a lot of you have this experience wherever you work, but this whole ideology of punching at the clock on the unit, no, we are punching at the nearest time clock. No more running through the hallways trying to fight to get on the elevator, stressing yourself out. Once I step foot in that building, I'm at work. Because God forbid, if a patient passes out or a visitor passes out right there when I'm walking into the building, I'm going to act. Therefore, if there's a time clock, I am punching in. I'm not waiting until I get to the unit. We are professionals. Nurses, we're upholding your organizations. We're punching in once we get into the building. So in 2023, we are working collaboratively with our nursing assistants. Yes, I know part of the job as a registered nurse is to delegate tasks to your assistant. However, as a nurse, we also have downtime where we can help them out. be it repositioning, be it helping to give a bath. We are working as a team. It's a collaborative effort. If I walk into my patient's room, and I've never done this, but I've seen it happen, walk into a patient's room and the urinal is filled, you'll have some nurses who will walk out and leave that urinal filled at the bedside. They won't empty it. We are emptying urinals. It's okay for us to empty Foley's. We can serve the trays. We can assist with feeding as well. Working collaboratively is one of the biggest goals for 2023, especially at the bedside where things are hard already and challenging for nurses and for the assistants. Last but not least, we are putting ourselves first, our families and our children, meaning that if you don't need to pick up that extra shift, don't pick it up. If the unit is short, they're just going to have to figure it out. Do not feel obligated to go in on your days off to help them out. It is not the nurse's job to staff the hospital. The hospital execs and administrators, that's their job, not yours. Put yourself first, take your time off, spend time with your children, spend time with your family. I hope I didn't say last but not least on the last clip, but last but not least, at the town hall meetings, employee meetings, we need to be on one accord. We're going to get on one accord. Do you guys see the nurses in New York City striking right now? They're standing in solidarity, and that is what we as nurses, we're doing that in 2023. No more fear to ask questions about staffing, about ratios, about raises. If one nurse has a problem, it needs to be the problem of all the other nurses sitting in that rooms. Nurses have a tendency to just be quiet and just absorb and take whatever comes their way. There's usually 1 or 2 nurses who's very outspoken and will ask questions, not afraid to query into certain issues, but they're usually by themselves without the support of their team members. So in 2023, be supportive of your fellow colleagues, especially in these town hall meetings, especially in like these staff meetings where pertinent questions need to be asked and we need answers. Anyway, thank you all for watching. I will see you all in the next video. Go ahead, like, subscribe, and comment. Also, leave me some comments on some topics that you'd like to see me do for 2023.